Have you ever thought about the impact papaya can have on your health? This common and accessible fruit hides impressive benefits that few people know about. While many see it as just another option for breakfast, papaya is actually a powerful ally for the body, capable of transforming your health in ways you might not imagine. It can improve heart health, rejuvenate the skin, and even strengthen the immune system. But beware, some common mistakes can prevent you from taking full advantage of everything papaya has to offer. Does papaya really aid digestion as they say? What's the secret to avoiding side effects, and how can it positively impact your skin? Stay until the end to discover all the details on how papaya can be a true treasure for your health. Before we start, don't forget to subscribe to the channel and activate the notification bell so you won't miss any updates. Let us know in the comments where you're watching from. We'd love to hear 8 benefits of papaya benefit. 1. Heart health. Let's start by talking about heart health. Papaya contains fiber, potassium, and antioxidants, which are essential for the proper functioning of the heart. Fiber helps reduce bad cholesterol while potassium helps maintain balanced blood pressure, promoting healthy circulation. Additionally, the antioxidants in papaya help combat free radicals that can harm the heart over time. Papaya is also rich in folate, a B-complex vitamin that helps reduce levels of homocysteine, an amino acid linked to an increased risk of heart disease. Combining these nutrients, papaya becomes an ideal fruit to care for the cardiovascular system in a complete way. When consumed regularly, papaya can be a valuable ally in preventing cardiovascular diseases, keeping the heart in shape and running like clockwork. Imagine that something as simple as adding papaya to your diet could mean a big step towards protecting your heart and ensuring a healthier, more active life. Benefit 2. Blood pressure regulation. Additionally, papaya is excellent for regulating blood pressure thanks to the generous amount of potassium in the fruit. It helps balance sodium levels in the body, which is essential for keeping blood pressure under control. This balance between sodium and potassium is crucial to avoid straining the blood vessels and ensuring blood flows easily. A potassium-rich diet is one of the most effective ways to promote healthy circulation and avoid dangerous blood pressure spikes. By consuming papaya regularly, you're not only caring for your heart, but also ensuring your blood pressure stays stable, away from hypertension risks. So, why not include papaya in your daily routine and give your circulation some extra care? Benefit 3. Immune system boost. Another remarkable benefit of papaya is its contribution to strengthening the immune system. Packed with vitamin C, papaya is a true boost for the body's defenses, especially for older adults, whose immune systems may need extra support. Along with vitamin C, papaya contains a good dose of antioxidants that fight free radicals, responsible for premature aging and the development of various diseases. These antioxidants also help reduce inflammation in the body, further strengthening natural defenses. By consuming papaya, you're literally shielding yourself against potential health threats, ensuring more energy and resilience to face daily challenges. It's like having a natural shield, just by adding this delicious fruit to your diet. Benefit 4. Skin health. Papaya is also a great ally for skin health. Rich in vitamin A, beta-carotene, and other antioxidants, it helps combat signs of aging, such as wrinkles and dryness. These nutrients promote cell renewal, leaving the skin more hydrated and with a youthful appearance. Papaya also contains enzymes that naturally exfoliate the skin, removing dead cells and revitalizing the tissue. Imagine enjoying healthier skin simply by adding papaya to your breakfast. Moreover, for those with skin issues like acne, papaya can be a natural option to improve skin appearance and texture, giving that extra glow we all seek. Topical use of papaya on the skin. In addition to being great for consumption, papaya can also be applied directly to the skin. The enzyme papain in the fruit is a natural exfoliant that helps remove dead cells, promoting smoother and more hydrated skin. Just mash a bit of papaya and apply it to your face as a mask for about 15 minutes to feel the benefits. Besides exfoliating, papain also aids in healing minor blemishes and scars. This simple practice can make all the difference, providing extra skincare without the need for chemicals. When used topically, papaya is a perfect example of how nature gives us practical and effective solutions to take care of our beauty in a healthy way. Benefit 5. Arthritis relief. Papaya also stands out for relieving arthritis symptoms. Its anti-inflammatory compounds, like vitamin C and antioxidants, help reduce joint inflammation, providing relief for those suffering from this condition. Adding papaya to your diet can be a strategy to lessen joint pain and improve quality of life. Moreover, papaya contains enzymes like papain that aid in the proper digestion of proteins, which is linked to reduced inflammation in the body. For those experiencing chronic pain, this simple dietary habit can be an important addition to conventional treatments, offering a more comfortable way to manage arthritis symptoms and live with greater freedom of movement. Benefit 6. Digestive health. When it comes to digestion, papaya is a true blessing. The papain enzyme in the fruit helps break down proteins, easing digestion and relieving that heavy feeling after meals. Additionally, papaya's fiber is excellent for maintaining regular bowel movements, preventing constipation, and promoting a healthy gut flora. Regular consumption of papaya can also help alleviate indigestion and acid reflux symptoms. Offering lasting digestive comfort for those who struggle with digestive issues like gastritis or constipation, eating papaya can be a practical and natural solution. Imagine starting your day with a bowl of diced papaya and feeling your digestive system work more smoothly and efficiently. It's a simple way to bring immense comfort to your daily life. Not only does papaya support smoother digestion, but it also nourishes your gut microbiome, contributing to a balanced ecosystem within your digestive tract. This fruit's anti-inflammatory properties can further reduce irritation in the stomach lining, which is beneficial for individuals with sensitive stomachs or ulcers. Papaya is also rich in antioxidants, which protect your digestive system from oxidative stress and inflammation. Incorporating papaya regularly into your diet may even aid in better nutrient absorption, ensuring your body gets the maximum benefits from the foods you consume. Benefit 7. Weight loss support. Another noteworthy benefit is papaya's role in weight loss. Low in calories and high in fiber, papaya helps increase feelings of fullness, essential for those trying to control appetite and avoid overeating. The fiber slows digestion and helps maintain stable blood sugar levels, preventing sudden hunger pangs. Additionally, papaya contains enzymes that aid digestion, which promotes better nutrient absorption and less fat accumulation. Adding papaya to snacks or salads can be a great strategy for those looking to lose weight healthily, without sacrificing a tasty and nutritious diet. After all, weight loss doesn't have to be a sacrifice, and papaya is here to prove it. Benefit 8. Vision protection. When it comes to eye health, papaya is also beneficial. Rich in vitamin A, lutein, and zeaxanthin, papaya helps protect vision by preventing issues like night blindness and age-related macular degeneration. These nutrients are essential for maintaining eye health, protecting the retina and improving vision quality. The antioxidant action of these compounds also helps combat damage caused by blue light exposure and free radicals. Regularly consuming papaya can be a practical way to care for your eyes and ensure clearer, healthier vision for years to come. After all, seeing the world with clarity is one of the greatest gifts, and papaya can be a powerful ally in this essential care. Precautions. Allergies and side effects. Despite all the benefits, it's important to take precautions when consuming papaya. Some people may be allergic to papaya, especially those sensitive to latex, as papaya contains a similar substance. Symptoms of a papaya allergy include itching, mouth irritation, and even breathing difficulties. Additionally, it's recommended to start with small amounts of papaya, if you've never eaten it before, to watch for any adverse reactions. In cases of severe allergy, seeking medical assistance may be necessary for proper treatment. Remember, reactions can range from mild to intense, and knowing the signs is essential to avoid complications. Furthermore, excessive papaya consumption may lead to digestive discomforts like diarrhea, due to its high fiber content. So if you notice any of these symptoms, it's best to avoid it and consult a doctor. Like any food, papaya should be consumed in moderation to prevent discomfort. Consumption during pregnancy. Another important factor is papaya consumption during pregnancy. Unripe papaya, in particular, contains papain, which can stimulate uterine contractions and lead to complications. Therefore, pregnant women are strongly advised to avoid unripe or green papaya. Moreover, papain, the latex in unripe papaya, can cause stomach irritation, increasing discomfort during pregnancy. This reaction can be even stronger in women with sensitive stomachs, making unripe papaya a risky choice. Ripe papaya, on the other hand, is safe and offers all the nutritional benefits mentioned, such as immune support and digestive aid. It's always wise to discuss dietary choices with a doctor during pregnancy to ensure both mother and baby are safe. Medication interactions. Excessive papaya consumption can also interfere with certain medications, especially anticoagulants and blood pressure medications. This happens because papaya has a diuretic effect that may amplify these medications' effects, causing imbalances in the body. Additionally, vitamin K in papaya can impact the effectiveness of blood-thinning medications, like warfarin, requiring medical monitoring. This effect on anticoagulants can increase bleeding risk or reduce treatment effectiveness, depending on the amount consumed. Another point to consider is that excessive papain consumption, an enzyme found in papaya, can interfere with some medications' absorption, especially antibiotics. So, if you're on any long-term medication, it's important to talk to your doctor before adding papaya to your diet to ensure there are no harmful interactions. After all, health is a blend of many factors, and harmony among them is key. Common mistakes in consuming papaya. Mistake 1. Not washing the peel. Another mistake when consuming papaya is not washing the peel before cutting it. Even if you don't eat the peel, cutting the fruit can transfer microorganisms or pesticide residues to the pulp. Ladies and gentlemen, brace yourselves as we dive deep into the curious world of tomatoes, our seemingly innocent red companions in the culinary world, and explore their potential dark side. That's right, today we're talking about the somewhat surprising claim that tomatoes, yes, those round juicy delights, might not be as harmless as they seem, particularly when it comes to our kidneys. Now, before you throw your heirloom tomatoes out the window in a panic, let's have a closer look at what's really going on. Let's find out if our beloved tomatoes are hiding a sinister secret. Could they be contributing to kidney cancer and other kidney problems? Or is this just another sensational headline meant to confuse and scare us away from salsa and marinara sauce? The Great Tomato Myth, setting the scene. Tomatoes have often been seen as the darlings of the produce aisle. Full of flavor, low in calories, and bursting with vitamin C, lycopene, and antioxidants, they've been touted as a superfood. You slice them into salads, throw them in your omelets, and even puree them into your world-famous pasta sauce, or so you tell yourself. But like every hero, they have a shadow side, or at least rumors of one. Specifically, some studies have hinted that high consumption of tomatoes could potentially contribute to kidney issues, including an increased risk of kidney cancer. How did we get here? And more importantly, what are the facts, and what's fiction? Tomatoes and oxalates, a complicated relationship. Tomatoes contain compounds called oxalates. Now, oxalates sound a bit like the kind of thing you'd hear about in chemistry class, probably because they are. Oxalates occur naturally in many foods, and they can bind with calcium to form kidney stones, those painful little deposits that can make grown people cry like babies. So, does this mean that by eating tomatoes, you're setting yourself up for kidney stones? Not quite. The truth is, you'd have to eat an absurd amount of tomatoes for them to pose a real threat. We're talking eating tomatoes for breakfast, lunch, and dinner levels of consumption. For most people, the oxalates in tomatoes don't add up to much trouble, especially if you're otherwise healthy and stay hydrated. But if you're already prone to kidney stones, then eating oxalate-rich foods might indeed increase your risk. So, tomatoes might not be inherently evil, but they could be a part of a more complicated picture for some individuals. You've got to ask yourself, how committed are you to your tomato habit? Kidney cancer, is it the tomato's fault? Now, let's talk about kidney cancer. The big, bad C word. There's some buzz out there that tomatoes could somehow increase the risk of kidney cancer. Let's unpack that. One of the arguments is that tomatoes, particularly when consumed in excess, contain lectins, a type of protein that's sometimes called an antinutrient. Lectins can bind to cell membranes and, according to some research, might contribute to inflammation in the body. Chronic inflammation, in turn, has been linked to an increased risk of cancer, including kidney cancer. But wait, there's a catch. The same lycopene that makes tomatoes so red and vibrant is actually an antioxidant that can help reduce inflammation. Confused? You're not alone. On the one hand, tomatoes have lectins that might stir up trouble. On the other hand, they have lycopene, which may be the hero in this story, swooping in to calm things down. The reality is, as with so many things in nutrition, moderation is key. Studies that link high tomato consumption to increased kidney cancer risk often deal with extreme cases. We're talking about people whose diets revolve around tomatoes as if they were setting up a lifelong tribute to pizza. Moderation, once again, is your friend here. The bigger picture, lifestyle factors. It's easy to point a finger at tomatoes and blame them for kidney problems, but it's worth remembering that kidney health is affected by a lot more than one food. Smoking, high blood pressure, obesity, and genetics all play a far more significant role in determining kidney health than whether you occasionally indulge in a tomato and mozzarella salad. And let's not forget the importance of hydration. Water is the unsung hero here, folks. Staying hydrated helps flush out toxins and prevents the formation of kidney stones. So, if you're worried about oxalates in tomatoes, maybe skip the panic and grab a glass of water instead. A tomato a day keeps the doctor away. Well, maybe not. You might be wondering if it's time to banish tomatoes from your kitchen. The answer is probably not, unless you're in the aforementioned group of people who are particularly prone to kidney stones or have specific dietary concerns advised by your healthcare provider. For the average person, tomatoes are still a healthy choice. They're rich in vitamins and antioxidants, they're versatile, and let's be honest, they're delicious. But if you do have a family history of kidney issues or if you're prone to kidney stones, it might be wise to have a chat with your doctor about how many tomatoes you're eating. A funny thought to wrap things up. In the grand scheme of things, the tomato is like that friend who's mostly a good influence but has a slightly chaotic side. Most of the time, they're bringing you good times and laughs, but every now and then, you get dragged into some questionable adventures. So, do you need to live in fear of the humble tomato? Not really. But as with all things in life, balance is key. Enjoy your tomatoes, but don't start a tomato-only diet. Sprinkle them on your salad, toss them in your pasta, and savor them, just don't go overboard. Your kidneys will thank you for it. And if anyone ever tries to tell you that eating tomatoes will lead you straight to a kidney catastrophe, feel free to send them a tomato emoji, just one, though. Moderation is important, after all. The history of tomatoes, from villain to hero. Let's take a moment to consider how tomatoes became such a staple of our diets. Interestingly, tomatoes weren't always as beloved as they are today. In fact, they were once considered poisonous. The plant is part of the nightshade family, which includes several toxic species, and Europeans in the 16th century were suspicious of these bright red fruits. Imagine that, the very food that makes our pizzas and pastas amazing was once feared. The tomato's transformation from villain to hero took time. When it finally gained popularity, it was thanks in part to Italian cuisine, where tomatoes became the base for many beloved dishes. From there, the tomato conquered kitchens around the world, and today, we can't imagine our diets without it. Tomatoes in the human body, the good, the bad, and the delicious. Tomatoes are rich in nutrients that our bodies love. Lycopene, the antioxidant that gives tomatoes their red color, has been linked to numerous health benefits, including a reduced risk of heart disease and certain types of cancer. Vitamin C, potassium, folate, and vitamin K are all abundant in tomatoes, contributing to overall health and well-being. However, as we've discussed, tomatoes also contain compounds that might not be ideal for everyone. Oxalates and lectins are the primary culprits, and for those with specific health concerns, these compounds could pose problems. It's a balancing act, enjoying the benefits while being mindful of the potential downsides. For most people, the benefits of eating tomatoes far outweigh the risks. They're low in calories, high in nutrients, and versatile in the kitchen. Whether you're making a fresh salad, a hearty pasta sauce, or a spicy salsa, tomatoes can be a healthy and delicious addition to your meals. The role of diet in kidney health. Kidney health is influenced by many factors, and diet is just one piece of the puzzle. A diet high in processed foods, salt, and sugar can put a strain on the kidneys, leading to issues like high blood pressure and diabetes, which are major risk factors for kidney disease. On the other hand, a diet rich in fruits, vegetables, whole grains, and lean proteins can support kidney health and overall well-being. Tomatoes can be part of a kidney-friendly diet, but it's important to consider the bigger picture. If you're prone to kidney stones, you might need to limit foods high in oxalates, including tomatoes. But for most people, tomatoes can be enjoyed as part of a balanced diet that supports kidney health. Hydration is also crucial for kidney health. Drinking plenty of water helps the kidneys filter waste and prevents the formation of kidney stones. If you're eating foods high in oxalates, like tomatoes, staying well hydrated can help reduce the risk of stone formation. Tomatoes in the culinary world, versatility at its best. One of the reasons tomatoes are so popular is their incredible versatility in the kitchen. They can be eaten raw, cooked, roasted, or pureed. They're the star ingredient in countless dishes, from Italian pasta sauces to Mexican salsas, Indian curries, and American ketchup. Tomatoes add flavor, color, and nutrition to a wide variety of dishes. They can be sweet, tangy, or savory, depending on how they're prepared. Raw tomatoes add a fresh burst of flavor to salads and sandwiches, while cooked tomatoes bring a rich, deep taste to sauces and stews. The versatility of tomatoes makes them a favorite among chefs and home cooks alike. They're easy to work with, widely available, and can be used in so many different ways. Whether you're making a simple tomato soup or a complex pasta dish, tomatoes are a key ingredient that brings everything together. Debunking myths, tomatoes and inflammation. There's a lot of misinformation out there about tomatoes and their effects on the body. Some people claim that tomatoes cause inflammation and should be avoided, especially by those with conditions like arthritis. But is there any truth to this? The reality is that tomatoes contain compounds that can both promote and reduce inflammation, depending on the context. Lectins, as we mentioned earlier, can potentially contribute to inflammation in some people. However, lycopene, one of the main antioxidants in tomatoes, has been shown to have anti-inflammatory properties. For most people, eating tomatoes is not going to cause inflammation. In fact, the anti-inflammatory effects of lycopene can be beneficial for reducing the risk of chronic diseases. If you have a specific sensitivity to tomatoes, you might need to limit them, but for the majority of people, tomatoes can be part of a healthy, anti-inflammatory diet. Tomatoes and kidney stones, the balancing act. For those who are prone to kidney stones, oxalates are a concern. Oxalates are naturally occurring compounds found in many foods, including tomatoes, spinach, nuts, and tea. When oxalates bind with calcium in the kidneys, they can form crystals, which may lead to kidney stones. However, it's important to note that not everyone who eats oxalate-rich foods will develop kidney stones. There are many factors that contribute to the formation of kidney stones, including genetics, hydration levels, and overall diet. If you're concerned about kidney stones, it's a good idea to talk to your doctor or a nutritionist about your diet. For most people, the key to preventing kidney stones is staying well hydrated and maintaining a balanced diet. Drinking plenty of water helps flush out the kidneys and prevents the buildup of oxalates. If you're prone to kidney stones, you might need to limit your intake of high oxalate foods, but that doesn't mean you have to give up tomatoes entirely. The verdict on tomatoes, friend or foe. So, where does that leave us with tomatoes? Are they a friend or a foe when it comes to kidney health? The answer, as with so many things in nutrition, is that it depends. For most people, tomatoes are a healthy, nutritious food that can be enjoyed as part of a balanced diet. They're rich in vitamins, antioxidants, and other nutrients that support overall health. However, if you're prone to kidney stones or have specific dietary concerns, you might need to be mindful of how many tomatoes you're eating. The key is moderation. Enjoy tomatoes in reasonable amounts, stay hydrated, and maintain a balanced diet that includes a variety of fruits, vegetables, whole grains, and lean proteins. If you have concerns about your kidney health, talk to your doctor or a nutritionist for personalized advice. A final word: enjoy your tomatoes, responsibly. In conclusion, tomatoes are not the villains they've sometimes been made out to be. They're a delicious, versatile food that can be part of a healthy diet for most people. While they do contain compounds like oxalates and lectins that could pose a problem for some individuals, the benefits of tomatoes far outweigh the risks for the majority of people. So go ahead and enjoy that tomato salad, that marinara sauce, or that spicy salsa. Just remember, moderation is key, and staying hydrated is essential for kidney health. Your kidneys, and your taste buds, will thank you. And next time someone tries to tell you that tomatoes are dangerous, you can smile, take a bite of your tomato, and say, only if you eat too many. Because as with most things in life, it's all about finding the right balance. Tomatoes and cultural significance, more than just food. Tomatoes are more than just an ingredient in our favorite dishes, they hold cultural significance around the world. In Italy, tomatoes are at the heart of the culinary tradition, featured in pasta sauces, pizzas, and countless regional specialties. The iconic red tomato is symbolic of Italian cuisine and is celebrated in festivals, such as La Tomatina in Spain, where thousands of people gather for a massive tomato fight. While the event is more about fun and spectacle, it's a testament to how deeply embedded tomatoes are in culture and community. In Mexico, tomatoes are a cornerstone of traditional cooking, appearing in salsas, stews, and mole sauces. The history of tomatoes in Mexican cuisine goes back to the Aztecs, who used them in their cooking long before the Spanish arrived. Today, tomatoes are an essential part of Mexican street food, adding flavor and freshness to tacos, tortas, and more. In the United States, tomatoes are ubiquitous, from ketchup to barbecue sauce to summer salads. They are grown in backyard gardens and used in countless classic American dishes. The cultural significance of tomatoes goes beyond their use in cooking. They are a symbol of homegrown goodness, often featured at farmers' markets and summer fairs. Tomatoes also have a special place in the history of agriculture. The development of different tomato varieties, from heirloom tomatoes to hybrids, reflects the evolution of farming practices and the growing interest in organic and sustainable agriculture. Tomatoes are a symbol of the farm-to-table movement, representing fresh, locally grown produce that supports both health and the environment. The science of lycopene, a deeper dive. Lycopene is one of the most researched compounds found in tomatoes, and for good reason. It's a powerful antioxidant that has been linked to a variety of health benefits, including a reduced risk of certain cancers, heart disease, and even protection against sunburn. But how exactly does lycopene work, and why is it so beneficial? Lycopene is part of the carotenoid family, which are pigments that give fruits and vegetables their vibrant colors. It's what gives tomatoes their red hue, but it also plays a significant role in protecting our cells from oxidative damage. Oxidative stress, caused by an imbalance of free radicals and antioxidants in the body, is linked to chronic diseases like cancer, cardiovascular disease, and diabetes. One of the interesting things about lycopene is that it becomes more bioavailable when tomatoes are cooked. This means that the body can absorb lycopene more efficiently from cooked tomatoes, such as in sauces and soups, than from raw tomatoes. So, while a fresh tomato salad is certainly healthy, a bowl of tomato soup or a plate of pasta with marinara sauce might actually provide more of this beneficial antioxidant. Studies have shown that lycopene can help lower LDL cholesterol levels, reduce blood pressure, and improve endothelial function, all of which are important for cardiovascular health. Additionally, lycopene has been studied for its potential role in cancer prevention, particularly prostate cancer. While more research is needed to fully understand the mechanisms, The evidence so far suggests that lycopene may help protect against cancer by reducing oxidative damage and inhibiting the growth of cancer cells. Growing tomatoes, from garden to table. For those who love gardening, growing tomatoes can be a rewarding experience. Tomatoes are relatively easy to grow, making them a popular choice for home gardeners. There's something incredibly satisfying about picking a ripe tomato off the vine and enjoying it fresh from the garden. Tomatoes come in many varieties, from small cherry tomatoes to large beefsteak tomatoes. Heirloom tomatoes are particularly popular among gardeners because of their unique flavors and colors. Growing tomatoes requires a sunny spot, well-drained soil, and regular watering. While they are generally easy to grow, tomatoes are susceptible to certain pests and diseases, such as aphids, tomato hornworms, and blight. However, with a little care and attention, these challenges can be managed. Growing your own tomatoes not only provides you with fresh, delicious produce but also gives you control over how they are grown. You can choose to grow them organically, without the use of pesticides or chemical fertilizers, and you can pick them at peak ripeness for the best flavor and nutrition. For those without a garden, tomatoes can also be grown in containers on a balcony or patio. Many dwarf varieties are well suited to container gardening, and they can provide a bountiful harvest in a small space. Whether you're growing a single plant in a pot or an entire row in your garden, tomatoes are a rewarding and versatile crop. The role of tomatoes in gut health. In recent years, there has been growing interest in the role of diet in maintaining a healthy gut microbiome. The gut microbiome is made up of trillions of microorganisms that live in the digestive tract, and it plays a crucial role in digestion, immune function, and overall health. Tomatoes, with their fiber content and bioactive compounds, can be beneficial for gut health. Tomatoes are a good source of dietary fiber, which is important for maintaining healthy digestion. Fiber helps keep the digestive system moving smoothly, preventing constipation and supporting regular bowel movements. The fiber in tomatoes also acts as a prebiotic, providing food for the beneficial bacteria in the gut. In addition to fiber, tomatoes contain polyphenol and other bioactive compounds that can have a positive impact on the gut microbiome. Polyphenol are plant compounds that have antioxidant properties, and they can help promote the growth of beneficial gut bacteria while inhibiting the growth of harmful bacteria. A healthy balance of gut bacteria is important for overall health, and tomatoes can play a role in supporting that balance. Tomatoes and bone health, surprising benefits. When we think of foods that are good for bone health, dairy products are usually the first to come to mind. But tomatoes may also have a role to play in maintaining strong bones. Tomatoes are a source of several nutrients that are important for bone health, including vitamin K, calcium, and lycopene. Vitamin K is essential for bone health because it plays a role in bone mineralization and helps regulate calcium in the body. Calcium is, of course, crucial for maintaining strong bones and preventing osteoporosis. While tomatoes are not as rich in calcium as dairy products, they do contain small amounts that can contribute to overall calcium intake. Lycopene, the antioxidant found in tomatoes, may also have benefits for bone health. Some studies have suggested that lycopene can help reduce oxidative stress and inflammation, both of which can contribute to bone loss. In fact, some research has found that people who consume more lycopene have higher bone density and a lower risk of fractures. While tomatoes alone are not enough to maintain strong bones, they can be part of a diet that supports bone health. Including a variety of fruits and vegetables, along with other calcium-rich foods, can help ensure that you're getting the nutrients you need for healthy bones. Tomatoes in traditional medicine, A historical perspective. Throughout history, tomatoes have been used in various traditional medicine practices for their potential health benefits. In some cultures, tomatoes were believed to have medicinal properties that could treat a variety of ailments, from digestive issues to skin conditions. In traditional Mexican medicine, tomatoes were used to treat digestive problems and to cool the body during fever. The Aztecs and other indigenous peoples of Mexico recognized the value of tomatoes not only as a food source but also for their potential healing properties. In European folk medicine, tomatoes were sometimes used as a remedy for skin conditions. The pulp of ripe tomatoes was applied to the skin to soothe inflammation and promote healing. Today, tomatoes are still used in some natural skincare products for their antioxidant and anti-inflammatory properties. While modern medicine has largely replaced traditional remedies, there is still interest in the potential health benefits of tomatoes and other natural foods. The use of tomatoes in traditional medicine is a reminder of the long history of this fruit and its role in human health and well-being. Tomato-based products. Not all created equal. When it comes to tomatoes, not all products are created equal. Fresh tomatoes are a healthy choice, but what about tomato-based products like ketchup, tomato sauce, and canned tomatoes? Let's take a closer look. Ketchup is one of the most popular tomato-based products, but it's also one of the least healthy. Most commercial ketchups are loaded with sugar, salt, and preservatives, which can negate many of the health benefits of tomatoes. If you love ketchup, consider making your own at home with fresh tomatoes and minimal added sugar and salt. Tomato sauce and canned tomatoes can be healthy options, but it's important to read the labels. Look for products that have no added sugar and low sodium content. Some canned tomatoes are also lined with BPA, a chemical that can leach into the food and may have negative health effects. If possible, choose BPA-free cans or opt for tomatoes in glass jars. Sun-dried tomatoes are another popular tomato product, and they can be a healthy choice as long as they're not packed in oil with added salt. Sun-dried tomatoes are rich in lycopene and other nutrients, and they add a burst of flavor to salads, pastas, and other dishes. Tomatoes and food allergies. What you need to know. While tomatoes are a healthy choice for most people, they can cause allergic reactions in some individuals. Tomato allergies are relatively rare, but they can cause symptoms such as itching, hives, and swelling of the lips, mouth, or throat. In some cases, a tomato allergy can cause gastrointestinal symptoms like nausea, vomiting, or diarrhea. Tomatoes are also part of the nightshade family, which includes potatoes, eggplants, and peppers. Some people with sensitivities to nightshades may experience inflammation or digestive issues when consuming tomatoes. If you suspect that you have a sensitivity or allergy to tomatoes, it's important to talk to your doctor for proper testing and diagnosis. For those with a true tomato allergy, avoiding all forms of tomatoes and tomato-based products is necessary. However, for most people, tomatoes can be enjoyed without any issues. If you experience mild symptoms after eating tomatoes, it's possible that you have a sensitivity rather than an allergy, and you may be able to enjoy tomatoes in moderation. The environmental impact of tomato production. Tomatoes are one of the most widely grown crops in the world, but their production can have a significant environmental impact. Commercial tomato farming often requires large amounts of water, pesticides, and fertilizers, which can contribute to water pollution, soil degradation, and greenhouse gas emissions. One of the biggest environmental concerns with tomato production is water usage. Tomatoes require a lot of water to grow, and in areas where water is scarce, this can put a strain on local resources. In addition, the use of chemical fertilizers and pesticides can lead to runoff that contaminates nearby water sources and harms wildlife. Organic and sustainable farming practices can help reduce the environmental impact of tomato production. Organic tomatoes are grown without synthetic pesticides or fertilizers, and they are often produced using methods that conserve water and protect the soil. Supporting organic and locally grown tomatoes is a good way to reduce your environmental footprint and promote sustainable agriculture. Growing your own tomatoes at home is another way to enjoy this delicious fruit while minimizing environmental impact. Home gardening allows you to control how your tomatoes are grown, and it eliminates the need for transportation and packaging, which are major contributors to the carbon footprint of commercially produced tomatoes. Tomatoes and culinary creativity, beyond the basics. While tomatoes are often used in familiar dishes like salads, sauces, and soups, they can also be used in more creative and unexpected ways. From desserts to drinks, tomatoes can add a unique twist to a variety of culinary creations. Tomato jam, for example, is a sweet and savory spread that can be used on toast, sandwiches, or cheese boards. Made with ripe tomatoes, sugar, and spices, tomato jam is a delicious way to preserve the flavor of summer tomatoes and enjoy them year-round. Tomatoes can also be used in desserts. Yes, you read that right. Tomato-based desserts are popular in some cultures, and they can be surprisingly delicious. A tomato tart, made with a sweet pastry crust and caramelized tomatoes, is a unique dessert that highlights the natural sweetness of tomatoes. Tomato-based drinks are another creative way to enjoy this versatile fruit. The classic Bloody Mary is a popular cocktail made with tomato juice, vodka, and spices, but non-alcoholic versions are also available for those who prefer a mocktail. Tomato juice is rich in nutrients and can be a refreshing and healthy beverage on its own or as part of a cocktail. Tomatoes can even be grilled or roasted to bring out their natural sweetness. Grilled tomatoes make a great side dish for barbecues, and roasted tomatoes can be used in a variety of dishes, from pasta to sandwiches. The possibilities are endless, and experimenting with tomatoes in new and creative ways can add excitement to your cooking. The bottom line, tomatoes are here to stay. Tomatoes are a beloved and versatile fruit that have earned their place in kitchens around the world. From their rich history and cultural significance to their numerous health benefits and culinary uses, tomatoes are a staple that we can't imagine living without. While they do have some potential downsides, such as their oxalate content and the possibility of allergies, the benefits of tomatoes far outweigh the risks for most people. Whether you're enjoying a fresh tomato salad, a bowl of tomato soup, or a slice of pizza topped with rich tomato sauce, there's no denying the appeal of this vibrant fruit. Tomatoes are nutritious, delicious, and versatile, making them a valuable addition to a healthy diet. So go ahead and embrace the tomato in all its forms. Just remember to enjoy it in moderation, stay hydrated, and choose organic or locally grown tomatoes when possible. Your body, your taste buds, and the environment will thank you. Top 3 vitamins that help stop proteinuria and heal your kidneys. Did you know a simple urine test may reveal your risk for future disease? Looking at your urinalysis report form, you will find your level of protein in the urine. If this number goes beyond 500 milligrams per liter, you may have proteinuria, which can show early stages of kidney damage. This damage is present when the kidney's filtering system is not working properly. In our previous video on proteinuria, we clarified that this is not a health condition on its own, but a symptom of kidney disease characterized by an excess of protein in the urine. Most people are unaware they have proteinuria. For those who have yet to watch these videos, please note that proteinuria may be temporary or persistent. Our proteinuria series will focus more on persistent proteinuria that is often due to chronic kidney conditions. Keep in mind that reduction in proteinuria can decrease further kidney damage, saving you from the harsh pain caused by unhealthy kidneys and expensive treatments in the future. So in this important video, we will discuss 3 vitamins that can help stop your proteinuria and assist in healing kidney damage. Find out which vitamins they are, why they're important, and how to get enough in your diet. Be sure to watch until the end to learn about the causes and prevention of proteinuria. Before we dive in, kindly note that all the information in this video is created by real people. You can visit our website at healthtoday.com to see our advisory board and the team behind these videos. We do not use artificial intelligence writing tools like ChatGPT to automatically generate content. Be assured, our information is thoroughly fact-checked, unbiased, and reviewed by qualified professionals. By providing this information, we aim to equip you with the knowledge necessary to make informed decisions about your diet. Now, let's return to the topic of vitamins that help stop proteinuria. The kidney's normal function is to filter blood and remove waste. The waste in urine contains excess water and minerals. The kidneys help maintain balanced fluids to ensure healthy blood pressure levels. Typically, the body does not leak protein into urine. What is clear is that any reduction in proteinuria will decrease further kidney damage. Some vitamins may be low in people with kidney damage. Replacing these vitamins, whether naturally in food or by taking supplements, may help improve kidney function by repairing tissues. More specifically, people may be low in many vitamins due to various reasons associated with kidney damage. First, the damage to the kidney's filtering systems, called glomeruli, may allow these vitamins to leak into the urine along with proteins. Second, malnutrition is common in those with kidney damage and may be related to a distorted taste and decreased appetite. It may also result from eating a diet low in nutrient-dense foods. Third, as kidney damage worsens, doctors may recommend limiting certain foods. In cases of severe kidney disease, foods such as certain types of beans, fruits, vegetables, and foods containing milk should not be eaten. These are high in potassium or phosphorus, which can be dangerous when not properly filtered out of the body. Finally, those with no kidney function due to severe disease require dialysis, a mechanical system of filtering the blood. This process presents even further challenges to meeting appropriate vitamin levels. Here, we will delve into the vitamins that can help reverse proteinuria and limit further damage in kidney disease. The first vitamin we will discuss is vitamin D. Vitamin D can be helpful in healing proteinuria and kidney damage for several reasons. First, vitamin D helps to rid the body of inflammation. Inflammation in the kidneys enlarges tiny tube-like filters within the glomeruli and causes proteins to leak. Decreasing the inflammation may decrease proteinuria. Also, vitamin D helps to balance blood pressure within the kidneys. When the kidney tissues are damaged, the kidneys attempt to increase blood flow to the area. However, over time, the excessive force causes even more inflammation and damage that triggers proteinuria. Vitamin D lowers the secretion of hormones and enzymes, such as renin and angiotensin, that can cause high blood pressure in the kidneys. Another function of vitamin D is to help produce antioxidants. Antioxidants decrease damage from harmful substances known as free radicals. Natural body processes, such as using oxygen and breaking down food, form free radicals. These antioxidants attach to free radicals and prevent further damage to the glomerular filtration system, the main cause of proteinuria. The protective effects of vitamin D may help prevent scar tissue formation in the kidney's filtering system cells. By preventing scar tissue from forming, the glomeruli function may improve, decreasing the amount of protein lost in the urine. However, studies remain controversial regarding vitamin D's effects on stopping proteinuria and healing the kidneys. A 2019 study published in the Journal of the American Medical Association looked at the effect vitamin D3 supplements may have on kidney function. Researchers studied over 1,300 patients with type 2 diabetes. After 5 years, vitamin D3 showed no significant difference in glomerular function. Another 2019 meta-analysis in the journal Kidney Blood Press Research examined studies involving almost 1,500 patients. These patients had kidney damage related to diabetes. The evidence showed that vitamin D supplementation of multiple forms reduced protein in the urine. Ensure you are getting enough vitamin D according to how much your body needs. According to the Kidney Disease Outcome Quality Initiative's 2020 recommendations, adequate vitamin D is necessary for those with any stage of kidney damage or disease. Vitamin D supplementation should be personalized and based on doctor recommendations. Adults over 19 should aim for 600 international units, or IU in short, intake, equivalent to 15 micrograms daily. Those over 70 need an increased intake to get 800 international units, or 20 micrograms daily. Many people get only a minimum amount of sunlight exposure. The recommended dosages consider this: sunlight exposure, eating foods naturally high in vitamin D, and eating fortified foods are additional ways to increase your levels. However, there are a few precautions to note if you plan to take vitamin D. First, vitamin D is fat-soluble and stored in the body tissues. Oversupplementation may result in toxic levels. Those with kidney stones or high blood levels of calcium should be especially cautious. Vitamin D supplementation can further increase the blood levels of absorbed calcium. This may cause an increase in stone formation. Lastly, vitamins containing D levels over 4,000 international units should not be taken without monitoring by a health professional. When it comes to timing, vitamin D can be taken at any time of day. However, this vitamin is absorbed best after eating foods containing healthy fat. When shopping for vitamin D supplements, you may notice two different forms. There is D2 or ergocalciferol and D3 or cholecalciferol. Vitamin D3 may be more effective at raising your blood levels over time. Foods naturally high in vitamin D include cod liver oil and fatty fish, such as mackerel and salmon. Liver and egg yolks also contain naturally high amounts of vitamin D. Also, mushrooms exposed to UV light contain high amounts of vitamin D. Fortified foods high in vitamin D are milk and plant-based kinds of milk. Finally, yogurt, orange juice, and certain cereals may also be fortified and contain high amounts of this critical vitamin in healing kidney damage. Make sure to read the nutrition facts label on the back of food packages for the amount of vitamin D found in fortified foods. Are you enjoying our video so far? If so, please give us some hints by dropping a like and we'll make more content like this. Vitamin E. The second vitamin that may decrease protein leakage into the urine and help heal the kidneys is vitamin E. Vitamin E may benefit the kidneys in several ways. First, vitamin E is similar to vitamin D in that it helps to reduce inflammation and protect tissues from free radical damage. In particular, vitamin E helps prevent free damage to cell membranes. Furthermore, vitamin E may help cells lining the kidney's filtration system repair themselves, a process called autophagy. Cells must undergo autophagy for normal functioning. Vitamin E may promote cells' energy conservation by limiting the amount of autophagy they perform. This vitamin may also play a role in ensuring the autophagy finishes to completion. In addition, vitamin E may also decrease the amount of waste accumulation during this process. Improvements in the cellular maintenance may improve proteinuria and overall kidney function. Studies showing the benefits of vitamin E are promising. One small 2021 study published in the journal Nutrients looked at 59 patients. The patients included had diabetic kidney disease and either an early form of proteinuria known as microalbuminuria or stage 3 chronic kidney disease or CKD in short, a more progressive form of the disease. While there was no significant reduction in proteinuria in this secondary study, there was an improvement in the preliminary research. The author notes the complex nature of studying vitamin E. When choosing to increase your vitamin E level, keep in mind these important recommendations and precautions. The recommended amount of vitamin E for adults 19 years and older is 15 mg daily. In addition, for those with kidney disorders, higher amounts of vitamin E may be used depending on the severity of the disease. People may use a short course of 200 to 400 mg daily, but only with your doctor's advice. Taking more vitamin E than recommended may reduce the body's ability to form blood clots and may cause serious harm. Vitamin E taken at high levels for extended periods may also increase the risk of certain cancers. Similar to vitamin D, vitamin E is fat-soluble and stored in the body's tissues. Taking high levels for extended periods may cause toxic levels to accumulate. If you have any health conditions or are on medications, it's essential to speak with a doctor before supplementing with vitamin E. How you take vitamin E may affect levels in your body. You can take vitamin E at any time of the day. However, some use vitamin E to help with insomnia and may prefer to take it at night. Because vitamin E is a fat-soluble vitamin, it is essential to take it with foods containing healthy fat for better absorption. When buying vitamin E, remember that standalone supplements can contain higher dosages than levels of vitamin E found in multivitamins. Typically, these levels are much higher than the recommended daily limit of 15 mg. Many foods are naturally high in vitamin E. These include sunflower seeds and nuts, such as Brazil nuts, almonds, and peanuts. Also, wheat germ and vegetable oils such as safflower, corn, and soybean oil are high in vitamin E. Furthermore, vegetables such as pumpkin, asparagus, and red bell pepper contain high levels. You will also find vitamin E in greens like spinach, beet greens, and collards. Finally, avocados and mangoes are additional sources of vitamin E. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 3. Vitamin B9, also known as folate or folic acid. Now we will discuss the benefits of vitamin B9 to help stop proteinuria and heal your kidneys. Vitamin B9 is also commonly low, particularly in those with severe kidney disease. First, like vitamins D and E, the antioxidant properties of vitamin B9 can help decrease inflammation and protect kidney tissues from free radical damage. Second, vitamin B9 used in those on dialysis may decrease damage in their dialysis access sites by reducing the occurrence of blood clots. Third, vitamin B9 may help lower the harmful effects of high blood levels of phosphorus in those with severe kidney disease. problems include binding to calcium by weakening bones to form small stones in different places around the body. In addition, vitamin B9 helps to break down an amino acid in the blood called homocysteine. At high levels, homocysteine may increase the risk of cardiovascular disease, kidney inflammation, and blood clots in those with severe kidney disease. One large study shows the beneficial effect vitamin B9 had on reducing proteinuria and healing kidney damage. The American Journal of Kidney Disease published a 2020 review of a large study called the China Stroke Primary Prevention Trial. The original study looked at over 1,300 patients who had high blood pressure and early to mid-stage chronic kidney disease. The results showed a greater than 80% decrease in the progression of kidney disease over the course of 4 years after taking daily B9. Recommendations for daily intake are based on how the body absorbs vitamin B9. Folic acid is the form of vitamin B9 in supplement form or food fortification. The body absorbs folic acid better than folate or vitamin B9's naturally occurring form in food. Therefore, the recommended daily amount of folate is measured in micrograms of daily folate equivalent. Adults over 19 should take 400 micrograms of daily folate equivalent, or DFE in short. This amount is comparable to 240 micrograms of folic acid and 400 micrograms of folate. Note that folic acid supplements or fortified food intake should be no more than 1 mg daily. Those with late-stage kidney damage, also known as end-stage kidney disease, or ESKD in short, may be prescribed a high-dose supplement of 5 mg daily of folic acid. However, you should only take high-dose supplements under a doctor's care. Precautions should be adhered to when taking vitamin B9. Both vitamins B9 and B12 work with iron to build red blood cells. Taking more than recommended may hide symptoms in those with a vitamin B12 deficiency. Also, taking more than the recommended amount of vitamin B9 may elevate the development of certain cancers. When shopping for vitamin B9, you will find it in multivitamins, prenatal vitamins, and B-complex vitamins. Methylfolate vitamins are also available for those with the gene mutation known as MTHFR. Check fortified food labels for the amount of vitamin B9 to ensure you eat the recommended amount daily. Vitamin B9 is available in many different foods. Dark leafy green vegetables like arugula, kale, and spinach are high in folate. Other vegetables such as Brussels sprouts, broccoli, and asparagus are also high in folate. Other sources high in folate include eggs, legumes such as kidney beans and peas, walnuts, and flax seeds. Lastly, fortified breads and cereals, pasta, corn masa, and rice contain high amounts of folic acid. Be sure to talk with your doctor about the benefits of taking vitamins D, E, and B9 to stop proteinuria and help heal your kidneys. Precautions now. We will discuss when you should talk to your doctor about kidney disease. Watch until the end of this video to receive critical information about the causes of proteinuria and how to prevent it. Earlier in the video, we discussed how proteinuria reveals your risk for future disease. We noted that kidney damage may lead to high blood pressure, diabetes, and heart failure. Talk to your doctor about ways to prevent or heal kidney damage. This may help you achieve optimal health. As damage progresses, you may start to notice the evidence of protein in your urine. It may appear dark, bubbly, or have a froth-like appearance. You may see puffiness in your extremities or face. When the kidneys cannot filter extra fluid into your urine, the fluid, known as edema, collects around the body. You may feel like vomiting or throwing up. This feeling happens when waste accumulates in the blood. You may notice muscle twitching or cramping due to the imbalance in salts and minerals. These symptoms may not be present all at once and may slowly worsen. Speak with your doctor right away if you experience them. Also, if you have chest pain or shortness of breath, call an ambulance or get help immediately. Always consult with a healthcare provider before making significant changes to your diet or vitamin regimen, especially if you have chronic kidney disease or other health conditions. So far in this video, you have learned that proteinuria is a sign of kidney damage. We discussed why taking vitamins may help stop proteinuria and heal your kidneys. You have also heard about symptoms you may experience in later stages of kidney problems. We will now briefly recap vitamins D, E, and B9. Keep watching to discover the causes of proteinuria and find ways to prevent it. Conclusion: vitamins commonly low in people with kidney damage include vitamins D, E, and B9. These vitamins may play a helpful role in stopping proteinuria and healing your kidneys. These vitamins are essential to decrease the harmful effects of inflammation and have antioxidant properties that prevent free radical damage. Other benefits of ensuring adequate vitamin D levels include reducing blood pressure and scar tissue formation within the glomeruli. Vitamin E may also help regulate cell maintenance and repair for normal functioning. Lastly, vitamin B9 may decrease the formation of blood clots in dialysis patient access sites. Vitamin B9 may also reduce harmful levels of blood phosphorus and homocysteine. The final segment of the video discusses the causes of proteinuria. Proteinuria may be a temporary or chronic condition within the body. Temporary causes may be low water intake or water loss, infection, high levels of physical activity, or heart failure complications. Low blood pressure, inflammation, or damage from kidney stones may also cause proteinuria. Long-lasting reasons a person may have proteinuria may result from a health condition. High blood pressure, diabetes, and heart failure affect the kidneys over time. Other reasons kidneys may become damaged include immune system disorders such as IgA nephropathy or lupus nephritis. Poisoning, certain cancers, and injury may also cause proteinuria. Preventing proteinuria may not always be possible in certain circumstances. However, here are some ways you can help prevent kidney damage. Ensure you have an active lifestyle, manage your blood sugar, eat a balanced diet of fruits and vegetables, drink adequate water, and take medications your doctor recommends. We hope you enjoyed this video and found the vitamin information and tips helpful to stop proteinuria and heal your kidneys. Please be sure to watch more of Health Today's informative videos. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Everything we've discussed in this video might be wasted if you don't watch the video on the screen. Here, we share the worst 22 foods that can ruin your effort to heal proteinuria and kidney disease. We also offer tips on how to still enjoy them or find great alternatives. See you there. Stay informed. Stay healthy.